Okay, I think you can hear me well. So today we continue with the part of the upper limb, and here I would like to talk more about the musculature of the upper limb. As you can see, and if you remember, we were talking about the extrapendicular muscles, both anterior and posterior ones, and now, so we have covered this portion, pectoral and scapular regions, and today we'll continue to talk about the axilla, the arm, and the forearm, and the part of the hand, as much as we can. Well, let's start first with a portion of the axilla where you can find the very first picture associated with different structures. You can see the picture A, which shows you um, the schematical representation of the region known as axilla. So here you can find how the axilla, literally, I mean this space, looks like. You can see here also the picture B with the different cross sections, as well as you can find the lateral view of the axilla here, as well as the simple anterior view. So let's start with the very first part here. Oh, sorry, very first part here, picture A, showing us that the axilla, or also known as simply the armpit, means that this is literally it literally represents the region, I would say, which is seen between the part of the arm and the pelvic girdle. Itself, the axilla represents like the pyramidal shaped structure, which you can see here schematically. And here you can find that the apical region or apex of the axilla is represented by the cervicoaxillary canal. So the canal where we have the passage of the different structures, such as innervation and the blood supply. At the same time, opposite to the apex of the axilla, we do have the base of the axilla, and the base of the axilla here is literally representing the widest region, where in case of the surface anatomy we can find the folds of the skin and the connective tissue, which are making, let's say like that, the boundary for that region. So that's how it looks like. Besides of that, that particular, I mean the apex and the base of the axilla, we do have also the different types of the walls. You can find here in a red color, sure, schematically represented. So in this picture, which is the picture, I think C, yes, in the lateral view, it is showing you, see the reddish colored line. So this line represents the anterior wall of the axilla. Well, posterior to it, logically, in the greenish color, you can find the posterior wall of the axilla. Here from this picture, which is the lateral view, it's not seen, but in these three pictures, so the picture A with this part as well as the picture B, you can find that medially oriented region, or the wall, which is seen here schematically in lilac or purple color, is known as the medial wall of the axilla. And the last one but not least, which you see here in the bluish color, it is the lateral wall of the axilla. So in case of the apex and the base, it's more or less clear and very well seen from this picture. So again, the part of the cervicoaxillary canal, and in the case of the base, you can find here that mainly the base will be represented by the cutaneous tissue, so the skin, as well as the subcutaneous connective tissue layers. It will be the parts of a deep fascia as well as the superficial fascia. In case of the walls, it is a bit different. here in the picture B, we have a really very nice uh, uh, um, visualization of the section through the axilla, where you can find anteriorly oriented wall, which is represented or bounded by extrapendicular muscles, anterior extrapendicular muscles, which we have covered in the previous lecture, known as the pectoralis major, the largest one, and pectoralis minor, as you can see here. So this is pectoralis major, so passing towards the humerus, and the pectoralis minor. On the posterior side, you again come back to the extrapendicular muscles, but they are posteriorly oriented, and you can find particularly the muscles which are representing the rotator cuff muscles, such as subscapularis, because you can see that it is the one attached to the subscapular fossa. So as you remember, it's on the surface anterior, or correctly or more precisely to say, it is the costal surface of the scapula, as you can see here. So that's how it looks like. At the same time, you can find the attachments of the latissimus dorsi muscle, although it is representing posterior extrapendicular muscle, and normally in case of its proximal attachment, it is attached to the part of the iliac crest, as well as to the parts of the lumbar region and the sacral region. It is passing up towards the humerus, as you remember, and makes the attachment on the medial lip of the intertubercular sulcus. So that's why you can find it here, you see. At the same time, besides of the latissimus dorsi, very large structure, you can find the similar attachment, but of much smaller type of the muscle, which is really truly represented as a part of the scapular muscles, known as the teres major. So as you can see, both teres major and the latissimus dorsi would be also contributing to the formation of the posterior wall of the axilla. Well, the medial wall of the axilla, it's even much more easier to understand. Why? Because in case of the medial most structures, what in this region, we do have the thorax and the muscles associated with that region. So in case of the thorax, we're talking sure about the ribs and muscles, as you remember, particularly one large muscle which is attached here. It is again the part of the anterior extrapendicular muscles, known as the serratus anterior muscle. So as a result, we could say that the medial wall of the axilla will be represented by the serratus anterior muscle, which is very well seen here in the picture B. So this is the serratus anterior muscle. And the last one, but not least, represented by the lateral wall here, you can find that the lateral lip of the intertubercular sulcus, as well as the attachment of the pectoralis major towards it, will be making the lateral most boundary of the axilla. Now the question is, what is this structure? What is this region, correctly to say? Well, simply, as you can see from this picture, we can say that the axilla represents a space which contains, which is bounded by musculature and the bony structures, as well as it is the one containing the adipose tissue and the neurovascular structures, so the nerve fibers and the blood vessels. So the nerve fibers are very well, and the blood vessels are very well seen in this picture. Let me make it bigger for you. here it is. So this is the one. This is the part of the brachial plexus, which I told you passing from the cervical region of the vertebral column, because it contains, as you remember, the spinal cord, a part of the central nervous system, passing down towards the axilla through the apex, this cervico-axillary canal, and then this innervation is passing towards completely the whole upper limb. At the same time, you do have blood supply, the blood supply which is giving rise to the blood supply of the upper limb, as it is about the innervation. But at the same time, both the innervation and the blood supply is also provided to axio-appendicular muscles as well. So this is important to remember. So it means that all of these structures that we've talked about previously, they will be dependent on the innervation and the blood supply, which are passing through the axilla. So we can say that the axilla is axilla literally means the armpit, as I said at the beginning. So one more time, this is the region where we do have the collection of the neurovascular structures as well as lymphatics. As you can see here, particularly the lymph nodes are represented in this region, which are draining the parts of the upper limb as well as the parts of the chest. In case of females, the breast will be also tissues of the breast will be drained towards the axillary lymph nodes. So that's how it looks like. This is the anterior view, and it shows you here large pectoralis major muscle, so which produces anterior boundary, as I told you, of the axillary region. So here you can find the part of the saw-like serratus anterior, as we said, and it's the one which produces here the medial wall or boundary of the axilla. So that's how it looks like. So for the part of the axilla, I need just for the understanding of the axilla itself. So here you can find just a couple of the pages, because afterwards it comes to talk about the blood supply, and you know that this semester we're not covering neither the blood supply nor the innervation, so this part is not needed. Now we continue with the next region. The next region represents the arm. So we've talked, as you remember in the previous lecture, we've talked about axio-appendicular muscles. Now we start to talk about the muscles of the free upper limb. So although there will be some of them attached to the appendicular to the pectoral girdle bones, but there is no attachment to the actual skeleton anymore. What do we see here? This is the medial view of the arm. So the medial view of the arm, devoid of the skin and subcutaneous tissue and even the part of the deep fascia. And we can find that from the region of the axilla, we have the formation of the blood supply, as I have already said, as well as the innervation towards the upper limb, free upper limb. Now, on my previous lecture, I have mentioned that mainly if we will talk about the whole upper limb, even including the pectoral girdle, we can subdivide all of the muscles into two main compartments. So they are anterior compartment and posterior one. So it wasn't case of the axio-appendicular muscles. We had both anterior and posterior one, yes, by their localization, The same happens in the case of the arm and the forearm as well. So in the case of the arm, you can find the anterior compartment muscles and posterior compartment muscles. How do you understand that what I'm showing you right now is anterior and posterior? Because it's the medial view. So what is the medial view? In the anatomical position, don't forget, always refer to anatomical position. So the region of the arm in case of anatomical position which is closer to the median plane would be the medial side or surface of the arm. So as a result, this is the medial view of the forearm, so from the medial surface. And sure, here you can find the anterior structures and posteriorly oriented structures. Honestly, the arm itself, although representing like a big part, yes, of the upper limb, does not contain too many, I mean in a number, too many of the muscles. The muscles are simply bigger here. They are, you know, more like they are bulkier rather than being large in the amount. This is a very good picture. This picture represents, you see the cross section, please follow that. This is the cross section, the level on the B and the C pictures. So the cross section of the arm, and that's what we can see on the cross section. So this is the anterior part and this is the posterior part. So all of you remember I told you that in case of the anatomical position, the movement which is produced, one of the most common, is the flexion and extension. And I told you that approximately everywhere, flexion is an anteriorly oriented movement, and extension vice versa. It is posteriorly oriented movement. So, in case of the upper limb in anatomical position, all, not most, all of the movement which are anteriorly oriented will be representing flexion. All of the movement that will be produced posteriorly oriented will be known as extension. That's why there is the alternative name for anterior and posterior compartment of the muscles, and this is flexors and extensors respectively. So the anterior compartment muscles, you can call them simply flexors. Posterior ones are known as the extensors. Now the question is, flexors and extensors of what? Of which part? Because whatever we've talked about in case of the axo-appendicular muscles on our previous lecture, we said they are crossing mainly the shoulder joint. So it means that any type of movement they were producing in the shoulder joint. So it means that if we talk about flexion of the arm, extension of the arm, I don't know, abduction of the arm, adduction of the arm, and so on, everything is associated with the shoulder joint or glenohumeral joint. Now what is left for us? The next joint, which is crossed by most of the muscles of the arm, is the elbow joint. So as a result, it means that anteriorly oriented muscles mainly will be producing the flexion at the elbow joint. So that's why we call them flexors. And posteriorly oriented muscles would be extending the forearm at the elbow joint. So meaning that the muscles of the arm will be in any case crossing the elbow joint, okay? But sure, additionally we'll have some crossings of the glenohumeral joint as well. So that's why here from this simple picture, which is simply the cross section showing you the anterior and large posterior compartment, we say we have flexor compartment and we have extensor compartment. The funniest thing is that in case of posterior or extensor compartment, we have only one muscle, literally, very large, known as triceps brachii, which shows us that it contains 3 heads. That's why we call it triceps. The three heads where? In case of the arm. That's why we call it triceps brachii muscle. In case of the anterior compartment, one of the largest muscle that we can find here would be the biceps brachii. So where biceps stands for that it has two heads simply, and why it is brachii, it's also clear. Yes, because it is oriented and associated with the arm. That's why it is brachii, because you remember I told you the arm is brachium in Latin, forearm is antebrachium, and the hand is manos. So as a result, we have the triceps and the biceps brachii muscles. So two largest muscles, which are, to be honest, they are the ones which are representing, in case of biceps brachii, it represents the chief flexor at the, of the elbow joint, or the flexor forearm at the elbow joint. And in case of the triceps brachii, it is the chief extensor, so the main extensor. Although if you will compare the biceps and the triceps brachii, logically that according to their strength and even size, sure, the triceps brachii is much larger, and as a result it produces the most of the motion. Yes, it's literally larger compared, for example, to the biceps brachii, which means that to have complete antagonism means opposite movement. Yes, so in this case, besides of the biceps brachii in the anterior compartment, we do have a couple of more muscles. And what are they? You can find here that we do have a part of the brachialis muscle, one of the muscles which you can find here, as well as we do have a portion of coracobrachialis, although it's not seen very well here, but let's go through this picture. So we have biceps brachii, we have brachialis muscle, and we do have coracobrachialis. So making it better to understand, and then let's come back to the previous picture so it would be more, like a solid knowledge of yours. So bony attachment, as always, here we do have the picture A. So it represented by the scapula, as you can see, and you can see here that we still have part of the coracoid process, the part of the humerus, and mainly the distal part or distal half of the humerus will be represented, or representing the attachment of that muscle. So starting with the first one, which I told you, the anterior most, known as biceps brachii. That's true, thank you. So saying that it's biceps brachii, so two heads are there, you can see that one head is known as short and one is known as long head. So what is the difference? Well, first of all, the passage of that two heads is different, as well as the attachment. So in case of the short head, you can find that it directly passes towards the coracoid process of the scapula and makes the attachment to the tip of the coracoid process of the scapula. But from the other side, you do have a long head, and we already talked about the long head. Just we've mentioned it when we were describing the humerus, and we said that in case of the humerus, it is containing in the proximal region, it contains two projections known as the greater and the lesser tubercle, and in between of them we do have intertubercular sulcus, or I told you we also call it bicipital groove. So why bicipital groove? Because the long head of the biceps brachii is literally represented here, because the tendon of that long head is residing in this longitudinal invagination. So, and as a result, we also call it I mean, not only the intertubercular sulcus, but also we name it as bicipital groove. So that's also correct name. From the other, yeah, and passing here, it literally crosses the shoulder joint, as you can see, and passes towards supraglenoid tubercle of the scapula, because literally on the superior and inferior parts or edges of the glenoid cavity, we can find small projections known as supraglenoid and infraglenoid tubercles. So in this case, in case of a long head of the biceps brachii muscle, we can find the attachment to the supraglenoid tubercle of the scapula. Okay? On the other side, so on the distal attachment, we do have several parts. So you can see that one of the important attachment here would be passing towards the radial tuberosity. So the radius, so one point of the attachment of biceps brachii would be on the radius, but on the other side you can see that it produces the flat and wide tendon, which is known as aponeurosis. So this is the aponeurotic type of the attachment, which is blending into the fascia, to the part of the deep fascia here. So as a result, we do have this type of the attachment in case of the biceps brachii muscle. You can find here the part of the glenoid cavity, and here is the tendon of the long head of the biceps and how it is passing towards the supraglenoid tubercle of the scapula and makes here the attachment. So this is a very interesting, very nice picture, to be honest. As we continue, the next two muscles of anterior compartment I'm talking about, known as the brachialis and coracobrachialis, as I said. What is the difference? Well, the brachialis, from the name, it's clear that it's completely associated with the brachial region, so with the arm. That's why you can find that it is literally localized at the distal half of the humerus, makes the attachment on the anterior surface of the distal half of the humerus, and that's also very well seen here on this region, so where you have only the bone, and then as you can see it passes towards the ulna. Yes, so and here we do have the attachment directly, a very simple attachment towards the ulna. Now the question is, what type of the movement do you expect to find both in case of biceps brachii, which is crossing the elbow joint, as well as the brachialis muscle? So what type of attachment do you expect? Sure, you expect to find the flexion of the forearm at the elbow joint. So this movement flexion, it will be dependent on that particular two muscles. That's why in some parts of the text you will see that they don't say the words chief, main flexor. Why? Because, like as I said, to compare with antagonist with the triceps brachii, they're a bit smaller type of the muscles, and that's why both of them should be contracting for making complete flexion. Okay, so and that's how it looks like. On the other side, you do have coracobrachialis, which by its name even tells you that it's not only the muscle of the arm, but it also has somewhere the attachment towards the coracoid process of the scapula, and that's true. you can find here the part of the coracobrachialis, which is making the attachment to the coracoid process of the scapula, as well as this is the median surface of the middle third of the humerus. So that's why, sure, this muscle won't have any connection with the flexion of the forearm at the elbow joint, but in this case we do have some flexion and some adduction of the arm. To be honest, like when we talk about the short head of the biceps as well as the coracobrachialis, what do you think? What else they can do? If you remember, I told you when we talk about a bit smaller type of muscles, which are not the prime movers, they're not the main structures to produce the movement, they are needed for the fixation, or we call it also the prevention of the dislocation of the joint, so that the joint surfaces would not dislocate from each other. You do need some fixation, so as a result the prevention of the dislocation of that joint. So that's why these two structures will be also assisting in that function. So this is the whole idea of the anterior muscles of the brachium, so of the arm. As we continue with the posterior compartment, you can find that main type of the muscle, it's only one. It is triceps brachii. But at the same time, you can find also one small type of muscle known as the anconeus muscle. Well, from its size, I do believe it's clear that it will be only assisting to the triceps, and also will be producing some help or assistance in the prevention of dislocation, so the fixation of the elbow joint. So now the idea of the triceps brachii, how does it look like? Triceps, 3 heads, simply to say. So you can find here one of the longest regions or structures, and that's why we call it simply long head of the triceps brachii muscle, and the rest are subdivided into the lateral and the medial ones. You see, lateral and the medial heads, and the long head of the triceps brachii. The funniest part is that, as it was in the case of a long head of the biceps brachii, where we had supraglenoid tubercle and its attachment was here, in case of the long head of a triceps brachii, you can find the infraglenoid tubercle and of the scapula, and as a result the attachment of that head or that part would be literally represented here. Okay, so here we can see that these two muscles are simply antagonistic to each other by both the attachments and as a result by the actions that they are producing, so the movements that they are producing. At the same time, you can find the lateral and the medial heads, which are completely, you see, directly associated with the whole posterior surface of the humerus. Here, the only region what you can find in this case would be where we have a radial groove and a passage of a radial nerve, but mostly all of the posterior surface of the humerus will be providing the attachment for the triceps brachii, particularly medial head and the lateral head, both of them. Now, what about, you will say, the attachment which is distal? Sure, if we say that or we expect that the action of the triceps brachii would be extension, yeah, of the forearm at the elbow joint, So it should be literally crossing the elbow joint. And the posterior side, we can find here the part of the olecranon. Do you remember? This hook-like structure of the ulna, where we will have the attachment. You see the attachment to the olecranon of the ulna. You can find it very well here in this particular picture in the bluish color. You see in the bony attachment. So as a result, sure, it's logical, the contraction of that muscle gives us the extension. Compared to anconeus being a very small type of a muscle, as I told you, we say that sheath extensor is the triceps brachii muscle. Okay? That's why here in our textbook we can find, as I again was telling in the previous lecture, here we can find a good table with the muscles of the arm, with the anterior compartment muscles, as you can see, and the posterior compartment muscles. So they're subdivided. Anterior compartment muscles, I need muscle name, proximal distal attachment, and muscle action. I do not need the innervation. The same happens here. Name, proximal and distal attachment, here action, and no innervation. For now at least. Next semester we will cover this particular innervation details. So yeah, oh, that's important thing. To compare the brachialis and the biceps brachii now. I said the words that in case of the opposite or antagonistic muscle, which is triceps brachii, I said that yes, you can very easily say that it's sheath extensor. Well, you'll say yourself there is nothing else, you know, it's just a small anconeus muscle which do not have even enough force for the extension. But if you will compare it to the anterior compartment, we can't say what is that much sheath flexor and why. For example, in case of the brachialis and the biceps brachii, you can see two important things, two important remarks here, which I want you to remember. In case of brachialis, it has the opportunity to flex the forearm at the elbow joint in any type of the position. Also, what does it mean? We are talking also about the ability of the forearm to be pronated or supinated. Pronated or supinated. So that's why in any type of the position, this flexion will be easy for the brachialis. But for biceps brachii, in this case we have like the condition for the complete flexion, and you can see it's the supination. So in anatomical position, for example, that's the idea, yeah? So when we make the flexion, here both biceps as well as the brachialis will be completely flexing the forearm at the elbow joint. If it's not the anatomical position and you still would like to make the flexion, in this case mainly it will be the brachialis muscle, because it is literally making the flexion in all of the positions. Okay? In case of the supination, when we have a supinative position, then we have the biceps brachii as well. So that's how it works. I told you that we'll go back to this picture. So we already know about anterior compartment muscles of the arm and posterior compartment muscles of the arm. So now what can we see here? So we expect to find that at the part of the at the superior half, because it's the superior half, yes, of the humerus, we can find the following muscles. Well, biceps brachii, first of all. What can we see here? How can we see? Biceps brachii has two heads. At least one of these heads should be seen here. Where it is attached, what did we say? Coracoid process. Thank you. Coracoid process of a scapula. So tell me please, which parts here are representing the short head of the biceps brachii? So if we'll go through, we do have this particular region. You see this muscle as an example. Does it look like as the biceps brachii? No, because it does have, you see the attachment somewhere in the middle already. And this type of the attachment, you remember, with the coracoid process, yes, would be represented by the coracobrachialis type of the muscle. But the one which you can see here longer, here you can find the part of the biceps brachii muscle. At the same time, the muscle which starts in the middle is known as the brachialis muscle. Here you already have the triceps because it's still the part of the medial view, so that's why here is the portion of the triceps brachii is very well seen. All of these muscles which you can find here, they are representing the extraappendicular muscles which we've talked previously about. So here you can find as an example. Here this part is the teres major muscle. By the way, we say that teres major represents like the lateral most edge of the teres major represents the boundary between the axilla and the free upper limb. So it's like, it like gives like the division. And even at the same region, the blood vessel which is passing, so before this edge of a teres major, it would be axillary artery. As soon as it is crossing it, it is already the brachial artery, so the one which passes towards the arm. It's just for saying, just for some anatomical orientation. So that's how it looks like. I think we have, here is also a very good picture. So the figure which shows you, this is mainly the parts of the, you see, posterior views in this case. You can find the portion of the spine of the scapula, and again posterior extraappendicular muscles. The main idea here to see whatever we have covered in previous lecture, knowing the distal attachments of that muscles, extraappendicular muscles. You can see that they are intertwined with the muscles of the arm, yes, because they are even overlapping each other, to be honest. So, and that's the idea of the anatomy here, so to understand also the layers of the muscles. It's not just the muscle itself, but understanding where exactly do we have it. So you can see here that they try to show you that here we do have the triceps brachii. Can you see the cursor? Should I make it a bit bigger? So here it is. This is the triceps with its long head. What did we say where we have the attachment? Towards infraglenoid tubercle, yes, of the scapula. And sure, it will be overlying by the teres muscles. We do have more superiorly oriented. It was the teres minor. That's why you can find how it is overriding a part of the long head of the triceps brachii. And here we have this teres major, which I told you will be producing the boundary of the axilla itself. Okay, here is the part of serratus anterior, which is not that much interesting for us. Yes, here you can find the portion of the infraspinatus muscle. You see, which is also, we can say that overrides the part of the triceps brachii muscle. So that's how it looks like. And sure, you would never see the structures if not cut through the deltoid. You see? If not cut through the deltoid muscle. That's the most interesting part. Because if we go back to, I think here we have this picture. Give me a second. I will try to show you without any cut. Wait. Let me try to show you these. Yeah, okay, here even. You remember this picture? So you see, neither, for example, infraspinatus is seen very well here, nor the head of the triceps, long head of a triceps brachii will be seen here. None of these muscles will be seen well because of this layering, of the muscles. So where the outermost, or correctly to say superficial most, sure will be the deltoid type of the muscle. If you remember, we said it has the attachment towards deltoid tuberosity, yes, of the forearm. So that's how it looks like. That's why literally the musculature, which is seen anatomically, sure, it has many layers. That's why when we talk about particular region, I don't want you just to memorize that, okay, there are the muscles, particularly this one, but we also should understand how they are layered and what is literally the anatomical relationship of these muscles to each other. That's why it's very well seen. You'll say, how can we do that? It's simple. We have so many different pictures here, and this visualization helps you to understand where the muscles are and how they are localized. So besides of that simple explanation, which sure tries to show you simply to find at the beginning where the muscles are attached and how they are attached, but after that, that's why you have additional figures for the better understanding. Here in this particular part of the chapter, I will need from you the beginning of the arm, the muscles of the arm, all of the subdivisions here. This everything is needed. So till the brachial artery. Sure, I don't need the arteries and I don't need the blood supplies, which you can find here. Okay? So that's how it works. As we go towards the next portion, we have here the parts of the forearm. Well, although the forearm looks like that it's a bit smaller, compared, for example, to the arm, like it may be slender type of the compartment, but it's not. According to the amount of the muscles that we can find here, it's like, it's enormous amount of the muscles, which are subdivided into the layers even. I'm not talking about compartments, because compartments are similar. You do have the anterior compartment, you do have the posterior compartment, the same situation, same subdivision here, but these compartments or groups are subdivided even more, into the layers, like superficial, intermediate, and deep layers, in case of anterior compartment, for example. At the same time, now let's talk about what type of movement we can expect from these muscles. Well, sure, most of these muscles will be crossing the wrist joint. As a result, we already assume and we expect that anterior compartment muscles of the forearm will be producing flexion at the wrist joint, and in case of the posterior one, they will be producing the extension. So again, anterior compartment are the flexors, posterior compartment are extensors. Isn't that logical? Yes, it is. Now the next question. Do we have any other type of movements at the level of the forearm? And we say yes, we do have pronation, supination. Yes? So pronation, supination. So that's why we say that in case of anterior compartment, we can find not only the flexors but also pronators. So that's why the anterior compartment of the muscles will be known as flexor pronata or pronata flexors. Vice versa happens in the case of posterior compartment. Besides of extension, you will have supination as well. So that's why this particular region is also known as extensor supinator type of the compartment, which is very well seen, to be honest, here. This is, like that. So you can see several pictures in one figure of all of the structures what we can find in case of the forearm. And you can find that all of the muscles here are making the division by two bones in the middle known as ulna and radius, and in between of them we do have, you remember, interosseous membrane, which mainly represents one of the fibrous type of the joints, yes, with the lack of the movement there. So this particular interosseous membrane is very well shown in this picture, and picture D, which shows us anterosuperior view and makes the division into the anterior and posterior compartments. In the bluish color, schematical bluish color, we can find anterior, or also known as flexor pronator compartment. And in the brown color, we can find posterior compartment known as the extensor supinata compartment. Would you like to have a rest for 10 minutes? Okay, let's make the rest and then let's come back. Thank you.